Imagine a scenario where children in the midst of mental health crises find themselves trapped in emergency rooms, waiting for days on end for appropriate care. This troubling situation is not just a local issue. It's a nationwide crisis that has been gaining attention. A few years back, John McConnell, a health policy researcher based in Portland, began to notice a disturbing trend. Young individuals experiencing mental health emergencies were flocking to emergency departments across the country, only to languish there for extended periods, often several days, as they awaited a suitable treatment bed. Emergency rooms are typically chaotic and noisy environments, which can be particularly detrimental for vulnerable young patients grappling with suicidal thoughts or severe depression. Even when they manage to secure a room, it's often devoid of windows, making it an even less suitable place for recovery. McConnell recognized the gravity of this issue, but it was challenging to grasp the full scope of the problem until a significant set of Medicaid claims data from 2022 became available. The findings from his recent study, published in the journal JAMA Health Forum, reveal the staggering extent of this crisis. Among the young people enrolled in Medicaid who visited emergency departments for mental health crises that year, over 10% were forced to remain in the emergency room for more than 2 days while waiting for a proper treatment bed. This translates to tens of thousands of children experiencing this distressing situation in just 1 year. McConnell notes that the study may even understate the issue, as their definition of boarding was quite lenient, considering stays of 3 days or more. This is not just about a 48-hour wait. We are talking about prolonged stays. He emphasizes. Another significant aspect of the study is the stark variation in experiences across different states. For instance, in Florida, 25% of emergency room visits for mental health crises resulted in extended waits, while New Mexico reported a much lower rate of just 5%. Oregon fell somewhere in between, slightly above the national average of 11.9%. McConnell attributes this crisis to several factors, one of which is the increasing prevalence of mental health issues among adolescents. Many of these young individuals are turning to emergency services for help. For example, the number of children needing psychiatric consultations at OHSU's Dornbecker Children's Hospital surged from 150 in 2016 to 453 in the most recent year, according to psychiatrist Rebecca Marshall in the university's report on the study. Despite the rising demand for mental health services, McConnell points out that healthcare systems have struggled to keep up. He argues that, despite the influx of funding into behavioral health, the care provided remains disjointed and lacks sufficient accountability. There's no single entity responsible for overseeing this issue, he states. He believes that community care organizations managing Oregon's Medicaid program should take a more proactive role and be incentivized to achieve better outcomes. The study suggests that state-level policies could significantly impact this situation. By assessing the entire continuum of care, including inpatient and residential beds, subacute beds, non-emergency department crisis support, and accessible outpatient services, policymakers could play a crucial role in alleviating the problem of boarding and its repercussions on young people and their families. The investigative reporting by Willamette Week has the potential to create tangible changes, influencing legislation, prompting action from community leaders, and even leading to the removal of ineffective politicians from office. So, what do you think? Is the current system failing our youth in crisis? How can we better support these vulnerable individuals? Share your thoughts in the comments.